Hello, welcome to the Shattering the Silence show on YouTube. My name is Eric Diaz. I'm your host, and the Shattering the Silence YouTube channel is brought to you by the National Shattering the Silence Coalition. And the National Shattering Silence Coalition, we all started off as people with lived experience like myself with schizoaffective disorder or any other disorder that would cause psychosis. And we also, it was also founded by people that have family members that were in psychosis and had schizophrenia related disorders. And we started off trying to help people navigate the system. And then we figured out the hard way through experience that the system was designed to fail. And now we're out here trying to make the system accountable and make sure that people can get the help they need and not just complain about gaps in service, but go out and hold the system accountable and the people within the system accountable and close these gaps in service. And we also offer support groups for caregivers that you can find at our website, Shattering the Silent, the National Shattering the Silence Coalition.com. And there's another, I had the privilege of interviewing for the Shattering the Silence channel show. I had the privilege of interviewing Judy Smith. Judy Smith wrote an awesome book that I recommend anyone who's interested in this YouTube channel watching. It's called Mothering Difficult Adult Children, and it's awesome. And Judy Smith also offers support groups for caregivers, and she does a lot of good. She spent years as a social worker professor. And when you watch this interview, the first thing I thought when I read the book, and the first thing I think the majority of people watching this are going to be like, why are there not more books like this out there? And now, without any further ado, I would like to show you the interview with Judy Smith. Judy, all right, today I am very, very grateful to be joined by Judy Smith, who wrote an awesome book that I read, and I recommend anyone that watches this YouTube channel. I recommend anyone that watches this channel reading this, or anyone else reading it, but it's very great. Difficult Mothering, Challenging Adult Children Through Conflict and Change. So Judy, good to have you.
Thank you. Glad to be here.
All right. And you are based in New York, right?
Right. New York City.
New York City?
Mm-hmm.
All right. And you work or you teach at Fordham College?
I'm now retired, but for 25 years, I taught social work at Fordham. Yep.
All right. And so is that how you got started with the idea to write this book?
I did. For most of my career, I've been interested in mothering, but I focused mostly on mothers of young children. So we all know that the first 3 years is one of the most formative years in a child's life. So I was involved in research that looked at factors that supported a mother in her role and factors that got in the way with her role. And then I actually got older, surprisingly, and my son got older, and I became interested in what was known about mothering adult kids. Well, and I actually did it.
Thank you for focusing on this, because rightfully so, a lot of people, there's emphasis on helping children. Mm-hmm. And like when you see children that have special needs, well, what happens to that special needs child when they're a special needs 50-year-old?
Right, exactly.
So ensuring that, well, that is great. And if you don't mind me asking, were there any personal reasons why you decided to write this book, as far as like your own family?
In terms of, my son had small bumps in his life, but nothing major. But as a child, my mother's sister had serious phobias, and her life was quite restricted. And I could never understand why my mother, had half of her emotional life focused on someone else and not me. And it was because her sister was vulnerable. And so I really learned at a very early age how mental health problems can affect everybody in a family.
Oh yeah, and thank you for pointing that out because it affects everything. Because just me, I have schizoaffective disorder, and just with me even being on my medication, it takes a lot of energy. Like I also have a brother with schizophrenia, and just the energy it takes to make sure that he's gets what he needs takes up a lot of my mental bandwidth. Like I think the brain of like as like a I don't but like just like your brain only has so much capacity. So that is something that I'm glad is being spoken about more. And how many of the mothers that you interviewed for the book had children that were dealing with severe mental illness?
I haven't actually counted them, but more than half of them. I mean, when I started the project, I didn't know I was a qualitative researcher, and I just went out to senior centers and asked parents to, first I said, what problems do your kids have when they were 2, when they were 5, when they were 10? And everybody was very excited to tell me, all their problems. I said, how about when they were 40?
Mm.
And then the room got very quiet. And somebody said, divorce, drugs. I said, well, I'd like to talk to you,
Yeah.
those of you who have kids with. So I didn't know what they were going to tell me. They might tell me that the problem was that their kid married somebody of a different faith,
Mm.
but the people who came forward were people who had adult kids with serious mental illness or substance use
And
disorder, or both.
you mentioned in the book that parents of adult children that are struggling sometimes feel responsible and maybe might be less forthcoming.
Absolutely. I mean, I think that's one of the themes of, and there's a whole chapter in the book on shame, blame, and mother blame, that mothers,
Blame and mother blame. So
yeah,
yeah, so it's not just them blaming themselves. Sometimes members of the community will blame the
yeah,
mother. And
yeah. Okay. So Dr. Jackson, who's a nurse practitioner researcher, did research with mothers who had adolescents who were having problems with drugs, acting out, and they reported when they would go for help, often the response they got from the service providers was the assumption that the mothers were doing something wrong.
oh, okay, and that's unfortunate.
And that happens a lot of time, that and in our society, so much of what women believe is that we can turn out perfect kids.
Yeah.
If we drink, if we don't have any wine when we're pregnant, and if we have a natural birth, and if we do this and we do that, our kids will be great.
All
And
right.
when
So you
don't
said
work
shame,
out,
blame, and mother blame. Is that what you?
right, right.
Yeah, I think that is some. Oh, well that is like I say. I'm glad this is being discussed. And you mentioned adolescent teens acting out. Is marijuana legal in New York?
Now it is, yeah.
Have you noticed that playing a role in any of your research with because I know marijuana, a lot of people with schizophrenia related disorders, whether it causes it or whether it's correlation or causation. I know a lot of people with schizophrenia just really like marijuana a lot, and it keeps their medication from working. Have you seen that playing a role with like making life more difficult for mothers trying to parent children?
Well, I think when I did my research, it wasn't legal.
Uh,
But now I run support groups, and moms talk about their frustration because they know the literature that smoking a lot of cannabis can really increase the likelihood of psychosis. So mothers are worried about this, but the law is not on their side. But certainly it is a concern.
all right. And mothers are often the primary caregivers for children with severe mental illness. Why do you think there aren't more books like yours?
That's a really wonderful question. I was shocked when I discovered, because, as an academic, when you start a project, the first thing you do is you get on the internet to
Mm.
see what other people have written. And I really could not believe how little there was out there. I thought, am I weird to be looking at this?
Yeah,
And
you, why am I the only one looking?
what's wrong with me? And then I realized there's something wrong with how people are thinking. And finally, I found work by Carl Pillemer and his colleagues. He's a well-known gerontologist who studies older parents and their kids. And he too wrote about the real absence of research that looks at the effect of what goes on in adult children's life, how it impacts mothers and fathers.
Yes, and this book is about mothers, but I've noticed as someone who's very active in NAMI, there are some, but it's mostly the mothers that are showing up at these support groups to get help for the child. And is that something that you've noticed, that it's mostly the mothers, the mother taking care of the adult child?
Yeah, I think I don't know if they're, I mean, I think in many situations, like even the people come to NAMI, there's may likely be a dad, but he doesn't necessarily come to the meetings.
Oh,
And
yeah.
so I think we say take care of is carrying the emotional weight. And I think everybody in my study was married when they gave birth to their child, but by the time they were 60, 70, 80, they might have become widows or they might have divorced, but there were some who were still married. And among those who were still married, one mom told me she felt, while her husband was very involved and very concerned, she felt she was the only one who bled inside, is what she said. She was bleeding inside from the worry and the pain. And she felt her husband could take a lighter attitude about it. And this has been confirmed by David Karp. I don't know, his work. He studied how families adapted to understanding that their adult child had serious mental illness. And he says that there is a gender difference. Men can compartmentalize in a better way than women can.
Okay. And and I read an article about in the 60s when the state of California closed the hospitals, that a big part of their plan was just their families would take care of them, and that a lot of the families are mostly responsible. But a lot of times they don't really get the resources. If the mothers are expected to step up and provide all this care, why do you think there aren't more resources available?
Well, my understanding is different than yours. When the psychiatric, what we call asylums, the very large hospitals closed, like Willowbrook, which was a good thing that they closed, but President Kennedy signed a bill closing them because they were warehouses.
Yeah.
It was not that families were going to be responsible. There were going to be community mental health services. There was going to be employment services, every place. The funding never materialized for that. So what ended up happening is that the families became the ones who were the safety net without any support, without any training,
Okay.
So
So
it's
you're saying it wasn't planned that their families would just take care of them?
no way planned.
Because
No,
I've heard about the plans to have these community centers, and I've also read that a lot of times they refuse to coordinate with the hospitals. Like they were more focused on the general population than the people being discharged from the hospitals. That's something. Have you read
yeah,
that?
they became more community health centers rather than specifically for people with psychiatric
Yes.
needs. Yeah, I think that I have seen that. Yeah.
All right. And you say in the book there is an unstated assumption that mothers will take care of their adult children with SMI. Why, in your view, is that assumption unstated?
Well, if we really, like, if they closed all the state hospitals and said, families, it's now in your hands, a government to keep its face would have to have had some resources for families who are doing that.
Okay.
So, and I think that partially being a mother is, we have certain cultural mandates about what we're supposed to do. We are supposed to be there for our kids when they're in trouble. That's what a mother does. That's hopefully what a father does. We are also supposed to launch our kids into independence. So I think every mother in my book who I interviewed, when her kid got in trouble and they knocked on the door, they said, I have no place to live. Can I come home? Every mother said yes. Because that's, as they said, that's what a mother does. That's my son, that's my daughter. But they didn't think they were going to stay there forever.
Mhm.
And when, especially if they were having untreated psychiatric breaks one after another, and they were psychotic and screaming at their moms, they didn't want them there, but they were very torn. There's no housing.
That is one thing that I see a lot of. A lot of families can offer support, but not housing,
Right.
because it's very just draining having someone in psychosis living in your home. And do you see a lot of that where families like they want to offer support but can't offer housing?
Well, yes, I think that's a huge problem, but they often do initially offer housing, and then it becomes untenable. But what I found from each mother I talked to is the painful decision to evict your
Yeah,
child to the streets.
and that's awful. No mother or father or anyone for that matter should have to make that decision.
Yeah, I mean, it's the most painful thing you have to do or can do, and many people will not do it. So they will live in a situation where their own lives are at risk and try to find ways to stay safe within that parameter.
And one thing that you mentioned that I know NAMI, we do a lot about trying to reduce stigma, but I
Mhm.
feel like in our efforts to reduce stigma, we sometimes gloss over the reality of what it's like to live with someone in full-blown psychosis. And you mentioned
Mhm.
adult protective services, which I was very grateful. And you mentioned that sometimes it leads to elder abuse, with the elderly having um, difficult adult children or children with mental illness. And talk a little bit more about just sometimes mothers don't want to kick their loved one out, but there's an elder abuse situation going on. Can you talk a little bit about that?
Well, first of all, coming back to the theme of shame and blame, the idea of having to call a
Mhm.
social service agency and saying, my daughter is punching me, my son is kicking down the door. That feels like the worst admission in the world. First of all, you're acknowledging that you have a very troubled child and there's stigma about mental illness. You're acknowledging that you can't control your child, which has a lot of people can't understand. So, and then they're afraid that somebody's going to come arrest your kid. Nobody wants their
Yeah.
adult child to go to jail. So there's a lot of reluctance in reaching out for help and telling the authorities, whether it's a social worker or the police, that you feel endangered by your own child. That has huge shame, and so much of family violence is not reported because of the shame involved in reporting.
One thing you mentioned that made me very happy in the book is that adult protective services can sometimes help adult children get into services.
Right? Yeah, adult protective services will come in if somebody files a report about a neighbor, but they only can work with if they think the person is cognitively impaired, if the parent is cognitively impaired.
Oh, so it's only if the parent is cognitively impaired. So
Oh,
say if
if you can make the decision. Like I interviewed one mom who said to me, she's telling me how difficult her son was and he could be abusive. And then she said, I love him so much, but I know he's going to kill me in my apartment.
yeah,
I said, what?
that's just wrong on so many levels. The fact that putting a mother in that situation, like there should be a way to step in. And
But
so,
I said to her, I have to, you know, in New York, we're not mandated reporters, but I said, I have to tell you that I have to call the person who referred you, a social worker referred her to me, because you're in danger and I have to help you not be in danger. And when I spoke to the social worker, she said she knew all of the mom's concerns. She had done everything to help her. but the mother was in her right mind. She wasn't cognitively limited. And we have the right in this country to make bad decisions.
I, I, I brings me to my next, a lot of parents that can provide housing would, are big advocates of AOT and Kendra's law.
Right.
And, I noticed, Kendra's law was not in the book. And, have you ever dealt with anyone, who's been, first off, Kendra's law is, mandated outpatient, treatment for people with mental illness in New York City. Most states, except for, I believe, Massachusetts and Connecticut have it, but it's mostly up to the local jurisdictions. And it kind of helps people it forces people into outpatient treatment, but they're not in the hospital usually. And did you work with any mothers whose loved ones were using Kendra's law?
I don't, now in my support groups, I have people from all over the country. So I do have several women who have availed themselves of mandated treatment for their son or daughter. Unfortunately, the one or two cases that I've met recently, it didn't hook on to long-term treatment for that person. So there were several times when the person was mandated. So I think it's definitely, I know this is a big push among advocates and family members, of the idea that we can just let our loved ones live on the street, making bad decisions for themselves. But I've met a couple of people who didn't fully, it's not the panacea, but it's definitely in the right direction.
I agree that it's not a panacea, because once you get them into treatment, if their lives are miserable, they're not going to want to continue. So I agree that it's not a panacea. And I agree kicking them out is not an option. Like no parent wants to have, especially when you know it's a no-fault brain disorder. Like they didn't choose to go out and have schizophrenia, and you don't want to penalize them to so that I completely understand. And I know they're trying to have like what we do a lot of advocacy at the National Shattering Silence Coalition is we want to have like a in between, like not the criminal courts, but a civil court to try to keep the points, because yes, no one wants to force anyone to force things against their will, but that mother you talked about, if she is murdered by her son, he's gonna be forced to be in prison regardless of, even if he did it because of a no fault brain disorder. And then describe disenfranchised grief.
Okay. Well, I call it chronic sorrow, which was actually named by a social worker in the 40s, working with parents of kids who had Down syndrome. And the idea of the grief that parents experience when their kids are not normal and not on the same trajectory. And I think for parents who have adult children with untreated mental illness, where the psychosis keeps happening over and over again, and their brain capacity gets diminished, there's a real sadness that the adult child hasn't become the person they want to become. And this is kids, your son was a great musician, your daughter was an artist, and that's gone by the wayside because of the untreated mental illness. And so there's a lot of grief for the child that you wish you had. You feel grief for them and you feel grief for yourself. But it's different than a real death, because when there's a real death, people come in and if you're Jewish, you have a shiva or a wake, and people around you know how to acknowledge your grief. When you have an adult child with serious mental illness, people don't say, and they don't even know what you're going through. So you are mourning without the community of your loved ones fully understanding what your loss has been.
And one thing that I encounter is even if people would be there to mourn with you, you don't want to violate your child's privacy. So that's
Right.
one thing that I I struggle with my family member is I'm very grateful that I have a comparable diagnosis, so I could talk about myself and just things, but not necessarily blabber my brother's business all over town. And that's
Right.
part of the reason I became an advocate was, yes, I have my own lived experience with schizoaffective disorder, but I'm able to a lot of family members wish they had that so they can go out and advocate without because like it's mental health is supposed to be private. People don't want to go out and talk about their son's their son's mental illness and how they can't get services for him. And I feel that's what's led to a lot of discrimination when it comes to insurance companies not covering something. They know no mother wants to go out there and say, my son can't get the psych meds he needs. And
Hmm.
that's something that, in my view, is kind of held back progress. And do you have you experienced any of because mothers are willing to provide housing that prevents them from maybe getting their prevents them from getting services? Like, say, I'm in a hospital and like, oh, his mom will provide housing, so we don't really have to find supportive housing. Like, do you ever see any of that?
Well, I think when I first started this project, whoops, you're right. When I first started the project, I did an informal survey with psychiatric social workers in the hospital. And I asked them, because I know for social workers who work in a psychiatric hospital, discharge planning is a big thing.
Mhm.
And I said, what do you do? How much do you ask the family if they're willing to take the child back? And uh, some people said, well, we ask, but the mother's too embarrassed to say we don't want him back. But I think from the social worker's point of view, there's a big push to get the person out quickly.
Mhm.
And in some states, I know in Canada, I had somebody in my groups, you're not allowed to discharge to homelessness. But in the US, you are able to discharge to homelessness in most states. But obviously, if the person had been living at home, the social worker is going to say, great, that we should do that. And the mom has to really be forthright to say, we can't do that. We want another solution. And that takes, again, we're talking about breaking the silence, acknowledging that this is uncomfortable is very hard for family members to do because
Oh,
they feel it's their fault that I'm a bad mom. What do I look like if in front of the social worker say, I don't want my son back in my house? What kind of person am I to say that?
yeah, that's like I say, it's a horrible situation for a mom to be in. And what role do siblings play?
That was not my study, but I think certainly mothers reported to me the resentment siblings have
Mhm.
about that the person who has the illness gets more attention, and all research shows that in fact that is true. The person who is the most vulnerable gets more financial attention from the family, gets more time, attention. So the siblings rightfully feel resentment that they're the second tier.
Yeah,
Uh,
that they so it creates a lot of resentment.
Possibly, and there's also the fear and the reality that they may become the caregivers as you have.
And did you ever encounter people like there were a lot of services that I wanted for my brother, but they said in Georgia, our public mental health said because he was on disability and had Medicare that he didn't qualify because he had too much resources.
To,
And do you ever encounter mothers trying to get help and they say, hey, you have too much resources to get help? Because there's a lot of public health stuff that is at times better than the what's available for people with private insurance, but they're not eligible because they have private.
I know that as a social worker across the board, the systems that we've set up with Medicaid and Medicare and private insurance often feel unfair that there may be better or more accessible services if you have less money. So it's a very tricky dilemma of how do you set up the who gets what in terms of income limits.
All right. And how common is denial, and how can mothers overcome it?
It's very common. I have a whole chapter in the book called Seeing or Not Seeing. And I think we, as mothers, like to see the best in our kids, and particularly when the problems start emerging. First, you think if it's starting in adolescence, well, this is part of, regular adolescence. And then in young adulthood as well, it's post-COVID and nobody can find a job. I think to begin to let yourself take in the fact that there is a serious problem takes a lot of courage, because it usually means then you have to try to get your son or daughter help. And that I really encourage people to take off their blinders and to really let yourself see if there is a serious problem and do what you can. The earlier you can get your adult child help, the better off they are going to be.
And how can mothers challenge their feelings of guilt and shame?
I think the best way is read my book, but besides that, to join a group with other mothers. I think there is nothing social. What I recommend in terms of change, and the third part of the book is about change. The most important first step is joining a group with other parents who have kids with serious mental illness. And it depends on how the group is run. I hope that support groups, because many groups focus on the person with the mental illness. I think what I'm recommending and what I hope more providers will do is focus on the mom herself. It's not just about the person with mental illness, and really discuss shame and self-blame, because that is such an obstacle to finding a way to lower your own temperature and to really be able to navigate this world with your son or daughter. But we need all family support groups to start really thinking about the mother's experience and the shame and guilt she carries, and really help her question that and address that.
That is so important, because some support groups, although well-intended, I've come out of there feeling worse, because it's just, oh, it's so hopeless, it's awful. And sometimes having support groups that maybe focus on the caregiver, but also focus on solutions. And so, yeah, you say, yeah, finding a good a support group, but a well-run support group is so important. And how can people access your support groups?
Well, I have a website. It's called difficultmothering.com. And, send me an email. I'm Judith R. Smith at difficultmothering.com. I'm pretty easy to find. If you just look up Difficult Mothering, I pop right up. And I'm hoping to be training other mental health professionals to use my model. There was just an article in the Times that highlighted my work. We need to.
And you were highlighted in the New York Times and the Wall Street Journal as well, I understand.
Right. But I think what I hear from mothers who've found their way to my work is they have felt unseen for so many years. That the problem, it's when you go for help, it's all about the son or the daughter, but there's another person sitting there who's suffering. And we really have to address the caregivers and their inner experience and their conflicts, and we have to provide services for the person who has the mental illness, because this is a catch-22, that families are being asked to do something that they can't do alone. This is not something, as caring a brother or mother that you are, you need a health system that really is going to be responsive to the person who has serious mental illness.
Yes, and I believe that's what I said. I've heard that from so many mothers of just special needs children, that people will ask how their son's doing, and they're like, he's doing fine. I'm struggling.
Right.
And like I said, I'm so glad that this is being discussed. And also, it'd be great if we can get a support group. Like I say, I always connect with siblings that have a loved one with a severe mental illness, and that's something that, like I say, is very important to just get support. And now that make sure the support is out there so that when people reach out for help, that it's there.
Mhm.
But also, is there anything that you would like to discuss that I didn't ask?
I think we've covered a lot. I mean, I think your question about why there is not more books on this, again, those of you who go, remember we once had bookstores that we used to go to all the time. There's fewer and fewer of them, but we have so many books on parenting young children. But
Mhm.
we need somehow the experience of caregivers and mothers in particular has been left out. And I hope those of you who are mothers will speak up and find yourself to a support group and make your voices known and maybe eventually become advocates. I know Leslie Carpenter is a mom who became an advocate, who spoke with you, is now at the Treatment Advocacy Center doing national organizing. So mothers can be wonderful, powerful voices. Housing That Heals by Teresa Paschini is another example of a mom who's become an advocate. So I think the more we move away from feeling shame and self-blame, we can do important things in society.
All right. Well, Judy, thank you so much for coming on. And once again, the book is Difficult Mothering Adult Children Through Conflict and Change. And like I say, go get it at your local bookstore. And if you're, oh, no, you can't.
No,
Oh,
it's
is that
not yet. You have to order it online at your favorite
all right.
online.
Well, I will include a link to Amazon on the YouTube channel to get it.
Or also, please ask your library to order it. Every public library will take requests and they will buy whatever book you ask. So if you will ask your library to buy the book, that would be great.
All right. Yeah. So ask your local library, and that's something I'll do here in Georgia.
Okay, that would be
Ask
great.
your local library. And Judy, thank you so much for coming on. And but also thank you for all that you do.
Okay, thank you for what you're doing. Okay, bye-bye, Eric.
All right.